Hello and welcome to the first in a series of podcasts on pre-hospital care. My name is Dr. Cosmo Skur, and today we're going to be going through a summary of pre-hospital care and the important points to appreciate when starting in this field. The first thing to understand about pre-hospital care is the different people who work within the environment. As medical students, you would be becoming a doctor to work in pre-hospital care, but obviously most pre-hospital care is undertaken by other specialties that usually work for the ambulance services. These include paramedics, commonly, as well as technicians. There's also a breed called the emergency care practitioner, who are paramedics with extended skills who are able to prescribe and give more primary care style treatments to patients in their own home. There are small amounts of nurses who work in pre-hospital care, often through organisations such as Basics, but also if you consider aspects such as district nurses and primary care trusts providing nursing services to people at home. There are also people working for the voluntary aid societies, such as the British Red Cross and St John's Ambulance, who provide first aiders and ambulance crews, and these can be found working at major events and at smaller events, but also during major incidents, or sometimes out helping the statutory ambulance services with their work. And there are of course the military, who are also very active in pre-hospital care. So as you can see, if you want to work in pre-hospital care in the future, it's important to understand the roles of all of the other medical professionals who can be working in this environment, understand their roles, their limitations, their skills and their aims, so that you can work with them effectively in a team. There are many different organisations involved in pre-hospital care. The first subgroup of these is the medical organisations, and they can be divided into those who provide care directly for patients and those organisations which provide information and support and regulate the work, and they're very important to know about as well. First, we'll look at the medical organisations who actually directly provide care in the pre-hospital field. Now, the most obvious of these is the statutory ambulance service. These can be large and small, and some of them cover much bigger areas than others, but all over England, ambulance services are NHS trusts, and some of them are becoming NHS foundation trusts with more independence. You also have air ambulances, which are often charity-based, and throughout the country there are different air ambulances with different aims and with different staffing on them. Some air ambulances have paramedics, some air ambulances have a paramedic and doctor team, and most of them throughout the country will cover both medical and trauma emergencies, but in London the air ambulance only covers trauma. You also have hospital emergency teams who are set up and trained to go out to major incidents, and these will usually encompass a senior anaesthetist or a senior A&E doctor, possibly with a surgeon, as well as an operating department practitioner and or a nurse, and they will work in the pre-hospital field and will have equipment and training to do so. There are also doctors working independently in the pre-hospital field, and these come under the umbrella of Basics, which is the British Association of Immediate Care Specialists. So Basics is an organisation of doctors who collaborate together to work voluntarily in the pre-hospital care arena. There are also organisations such as the Primary Care Trust who provide community nurses, and organisations of GPs who provide visiting services. And although these are less acute, that's still pre-hospital care and people that you would encompass and possibly come across when working in pre-hospital care. So again, there are also organisations within pre-hospital care which are medical but which don't directly provide care themselves but provide advice and support. Again, Basics, although some of their doctors provide care directly, they're also involved in training and running exams and accreditation for these doctors. They also have yearly meetings where people can keep up to date with the latest skills. Then there are the insurance companies, which need to provide cover for people working in pre-hospital care. There are also the professional bodies which need to be involved when you're working in pre-hospital care. There are then the non-medical organisations and people who work in the pre-hospital arena, and it's very important to understand what these organisations do, what the people within them are trained to do, so that when working with them you work well within a team. There's obviously the fire and rescue service, who are very important, not obviously just in fires, but also in extraction during accidents when people are stuck in vehicles or stuck in contained environments. There's the police service, who are involved in scene safety and in the pre-hospital care practitioners' safety as well, and often in protecting vulnerable psychiatric patients. And other organisations such as the Coast Guard and the Royal National Lifeboat Institution. It's important when working in pre-hospital care to appreciate the work that different people do and to understand what they are trying to achieve in the pre-hospital environment. And if you understand their training and what they're trying to achieve, then when you would be able to appropriately task them and ask for their assistance when trying to treat acutely ill people in pre-hospital care. So becoming a pre-hospital practitioner can be done in many ways. If you're a paramedic or a technician or working for an ambulance service, there's a direct training route which is set out for you. If you want to work in pre-hospital care as a doctor or as a nurse, the training scheme is at the moment much less direct and it's much more self-directed. Some ideas for how you can become involved are to learn about the specialist type of work through things such as podcasts. There are also e-modules online through different organisations which can be very helpful. Clinical guidelines are always worth reading, especially clinical guidelines in the pre-hospital arena, such as the ones produced by J.R. Calc. There are many books on pre-hospital care targeted at different professionals, but all encompass broadly the same principles, which are worth being familiar with if you want to work as a pre-hospital practitioner. And then there are courses you can go on which are specialist for pre-hospital care, such as the Pre-Hospital Emergency Care course run by Basics and Pre-Hospital Trauma Life Support course. Working in pre-hospital care has some massive challenges, and this is what people like about it. This is why people want to work in pre-hospital care, but they need to be understood so that they can be dealt with and minimised so that working is safe. The first of these is the environment, and as you can see here, there are differences with working out in the weather, there are difficulties with the light, there are difficulties with noise, you can often be in tight space, and there are dangers around you which you need to be aware of. And controlling all of these and understanding how they affect you when working is very important so that you work to the best of your abilities out in this different environment. Dangers will come across later, but controlling these and minimizing these is very important, and it's one of the difficulties with pre-hospital care. One of the other challenges is the equipment. You often have much less than you would have in hospital because you can only carry portable things. There's no arterial blood gas analysis, for example. Ventilators need to be small, but there are portable ventilators. And all of the equipment needs to be packed up tightly so it can be carried. So it's very important to be familiar with the packaging and layout of all equipment so that it can be found quickly and safely. And all of it needs to be carried, so it needs to be thought through which equipment you're going to take and which bits of equipment are so critical that spares should be carried as well. Patient assessment is different in pre-hospital care, and it's harder in many ways. The things to understand are that you need to get a history from the patient if they're able to, as well as history from the witnesses. and witnesses will often not come to hospitals, so pre-hospital care gives a unique chance to ask witnesses what happened and what they saw if someone's become acutely unwell or if there's been a traumatic incident. You also have the possibility when working in pre-hospital care to examine the scene, and this is one of the central facets of trauma life support in pre-hospital care, is to examine the scene and to examine any wreckage so that you can ascertain what the likely injuries to a patient are. Often, for example, if you find that the steering wheel has been damaged, you can suspect that there will be chest injuries in a patient, and other patterns of damage can be commonly associated with other injuries. When working in pre-hospital care, you have the chance to look for these so that you can assess your patient with that in mind. Also, examining the patient can be harder in the pre-hospital environment as they're often clothed or maybe trapped, and in a different environment it can be a challenge to overcome. One of the other things about pre-hospital care is it's often acute emergencies, and this can be very high pressure, and this is both a challenge and also the reason many people want to work in this environment. And of course there are the major incidents with complex scenes, complex dangers, and with multiple patients, and this makes it hard because you need to triage people and treat people appropriately. And this is again one of the challenges, but also one of the reasons people like working in this way. So the essential thing about being a good pre-hospital practitioner is that you need to prepare, so learn about the work, train regularly, and learn from resources that we talked about before. And then you need to be using a structured approach so that everything is covered and you treat life-threatening emergencies first. And as we've mentioned, by talking about the other organisations and the other people who work in pre-hospital care, team skills are critical. And if you cannot work well with other people and with people you've not met before effectively, then it's very hard to be good in the pre-hospital arena. So this is the approach to acutely unwell patients, and this is the standard approach in any unwell patient in pre-hospital care. As you can see on the left, we have danger, R for response, and then airway, breathing, circulation, disability, and exposure. In another podcast, I talk about the ABCDE approach, which is part of the primary survey, where this has gone into in more detail. But here we'll talk about danger, which is always important when assessing a patient, but in pre-hospital care, the danger and scene assessment is one of the most critical parts to the whole process. What needs to be done is the scene needs to be assessed, and this is for many reasons. This is because there's dangers to you, and these need to be minimized. There's danger to other rescuers, which needs to be taken into account and minimized. There's danger to the patient, which needs to be considered, especially if you think the patient shouldn't be moved, and often a risk analysis needs to be done to decide whether you're going to move an unstable patient to get them away from danger or not. And you also need to assess the scene to look for clues to the likely injuries or illness, as I spoke about before, as part of scene assessment. The danger to you is probably the most important of all of these, because if you become unwell or if you become injured, then you add to the problem rather than adding to the solution. And this is why you need a safe approach, which we will talk about in the next podcast on the dangerous environment. This is also the reason that anyone working in this arena needs to be wearing personal protective equipment. Examples of personal protective equipment are, at a minimum, helmet, boots, high visibility clothing, and eye protection. So as I say, assess the scene, minimize dangers, and look for clues to the patient and why they are so unwell. Having seen if the patient is responsive or not, you then move on to airway and breathing once you have called for help, and the details of the airway and breathing are in the other podcast. Circulation is next, and in the podcast on circulation and circulatory collapse, this will be covered in more detail. So this is the goal: to provide the highest quality care to the patient by using the right resources, people and teamwork. And as you can see from everything that we've talked about, this requires training, revalidation, good note keeping, consent, insurance and clinical governance. And in the next podcasts we will go through the primary survey, then we will go through airway and breathing, and then we will go through circulation in much more detail.